Today we are doing PRF, platelet-rich fibrin, and we are going to be injecting it under our patient's eyes. So this is an alternative to filler. So first we're going to draw her blood. So here we go. Okay, ready? Push it in. There we go. Perfect. And we fill up 2 to 4 canisters depending on what we're treating. And I don't know if canister is the right, tube is the right word for it. And it's pretty simple, not a lot of blood, but enough. And almost done with this part. Look, and you can see how simple the blood draw is. Yeah. It's great when people have great veins like you. And, all right, I'm gonna pull this. And 1, 2, 3, okay, good. Perfect. All right, so now we're gonna spin it and we'll come back and show you that part. All right, so we've got our 2 tubes filled, and we are going to go ahead and spin these, and you'll see how the fibrin separates out from the red cells. So now I'm going to do a little bit of numbing on each side, and this is lidocaine. 1, 2, 3, a little spicy, a little spice, and this is where my cannula is going to go in, because I like to use a cannula to inject PRF. It's just a bit safer. We're going to go on this side too. 1, 2, 3. Then using a needle. But in order to get into the skin, because I do use a blunt tip, I need to do a little lidocaine, make a little channel, and then we'll get the cannula right in through there. So you'll see what I mean in just a minute. But that's just the lidocaine injection. That'll just take a minute or two to kick in. I'm going to have you hold this and just kind of rub. And then I'm going to show you the PRF from the PRF machine. So I'm going to have you just kind of rub those spots. And now I'm going to come over to our PRF machine, and you can see all the red cells, and up at the top is our PRF. So I'm going to withdraw that. So one thing at a time here. So that spin was just 5 minutes, so it's pretty simple and quick. And we're going to take the needle. We're going to withdraw this good stuff. And for eyes, we just need about 1 cc per side. Usually recommend doing 2 treatments initially, sometimes 3, depending on the deficit under the eyes. You can combine PRF with filler. There we go. So this is going to be one of her injections. So we're going to go ahead and change out, put our cannula on this. I'm going to move right into, so this is my cannula, right here. Blunt tip, there's no needle at the end of it, although it looks like there's a needle. There's no needle at the end of it. Okay, now we're going to come over to our patient. And let's check and see how numb you are here. Let's wipe you right here. And can you feel that as they poke? Oh, good. Okay, there we go. Beautiful. So that's just my channel, because again, I don't have a needle at the end of this. This is just a blunt tip. So we're going to use our channel there. I'm going to have you open your eyes for me. Good girl. All right, here we go. And then we're just going to push up, just like if it was filler, we want to be deep in there. And instead of filler, it's PRF. So you can see the cannula right there. You okay? Mm-hmm. You know, it's a little weird. Okay, here it comes.
You can feel it coming in.
Yeah. And you will get some swelling with this for a day or 2. So I don't usually recommend this before you're going to go out to an event or anything. And then what will happen is the swelling will go down. And over the next couple months, 3 months, it'll take for you to make your own collagen from the PRF that we're injecting. But, okay, look up for me one more time. Go a little closer. You actually can't get to your eyeballs, so you don't need to worry about that. And the nice thing about the cannula is that it's very safe, so a lot less likelihood for any bruising, because if I run into a vessel, it just pushes that vessel aside. So it's nice in terms of the bruising side effects that could happen if you use a needle use a needle anywhere. Okay, we're gonna come back lateral one more time. La 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 la. Sometimes it just takes a little push. There we go. So, well, she's gonna, and we can see how that gave her immediate volume right now. But then, in about 3 to 4 days, that's gonna come down. And then in 3 to 4 months, she'll have her final results. But she's gonna come back for another treatment in a month, and we're gonna do it all over again. And like I said earlier, I recommend usually 2 spaced a month to 8 weeks apart. And then we'll see if we need a third. If we don't need a third, fabulous. We save that for our maintenance once a year.